Another important factor when we're talking about cancer is cancer prevention. A lot of people ask me what they can do to reduce the risk of developing cancer. To answer this, we have to look into the risk factors, which are things that increase our chances of developing cancer. I would like to say to you, ladies and gentlemen, that cancer can happen to anyone. None of us is immune. It is not because of bad luck or munyama, like some people think, or being bewitched, kuroiwa. It just happens.
Zim Quick TV, bridging information gap.
Ladies and gentlemen, the title of my presentation today is Facing Cancer with Courage and Hope. I would like to acknowledge all the cancer survivors that we have here and patients that are currently going through the cancer journey. It is not an easy journey, and to also acknowledge that most of us, if not all of us, have been touched by cancer in one way or the other. So I would just like to acknowledge that some of us have lost friends, relatives, loved ones to this disease. So today I am talking about cancer. It is a word that can evoke fear, uncertainty, and vulnerability. But my job is also to show you that that word cancer does not necessarily have to evoke this fear. A lot of the times when we hear the word cancer, we think of death. Tinofunga rufu. My job here is to try and change that. We really have to change that narrative. Cancer does not necessarily have to mean death. One of the reasons I usually agree to give talks is because of a patient of mine that I had. He was a chief from Manicaland with, unfortunately, stage 4 prostate cancer. It had spread to his bones, to his liver, and he was dying. He asked me, Muzukuru, urukundiudza kuti ndaita dambudziko reprostate cancer. Saka chirwere ichi munotochiziva, kati tochiziva takachidzidza kuchikoro. His question to me was, how come as a chief we had never gone to his province, to his district, to educate him and the people under him about this cancer? That was his first time hearing about prostate cancer, and unfortunately to hear that this disease was going to kill him. He said when AIDS was at its peak, the medical professionals would go to him as the leader of Nunurake. They would come to him first and he would gather people and they'll be educated about HIV and AIDS. But his major complaint was nobody goes out there to tell them about cancer. So when sister asked me to come and talk to you, I was more than happy, so that I can educate people about these cancers, and you can know that we have these cancers and you can be empowered to do something about them. And that is the good thing nowadays. There's a lot we can do to prevent cancer, to catch it early, to treat it and cure it. As we may be aware, cancer cases are on the increase. We are diagnosing cancer more and more. And according to the WHO, 1 in 7 people will develop cancer in their lifetime. I think we're averaging 7 on our tables, and you can imagine how common this is, that one person on the table may develop cancer. That's just how common it is. It is among the leading causes of death, with nearly 10 million cancer-related deaths annually worldwide. And the unfortunate thing is majority of these deaths occur in developing countries such as ours due to late presentation. To prevent these cancer-related deaths, early detection is key. In Zimbabwe alone, it is unfortunate that about 82% of our patients present themselves with stage 3 and stage 4 disease, which is very advanced and not curable in most cases. As a nation, we need to change this through encouraging regular checkups for men and women. We recommend routine screening for breast, cervical, prostate, and colon cancers. I would like to pose a question to all of us here. You don't have to raise your hands, but how many of us have had our annual cancer checkups this year? For women, have you had your mammograms? This applies to women over the age of 40. Maenda ere kuma mammograms enyu. Vakadzi. Have you gone for your pap smears to check for cervical cancer? Your VIACs. Maenda ere kuma VIAC. Please, these tests are there to save your lives. Let us take advantage of them. Men, you are not exempt. How many of you have gone for your annual PSA checks? I'm seeing very sober faces looking back at me. All the men in here, if you're 40 and above, you should have gone for your annual PSA checks. And for men, it's much easier. It's just a simple blood test. These days, we even have a pinprick, which gives you results in a couple of minutes. So you really don't have an excuse. Much easier, much cheaper. We still have November and December. So men, you still have time for 2024 to get your PSA checks. These will test for prostate cancer, catch it early, and you can be treated, and we save your life. How many of us here who are over the age of 45 years, how many of us have had their colonoscopies? Colonoscopy is checking for colon cancer. This is also a very common cancer in the top 5 cancers in Zimbabwe. We can actually proactively look for this cancer through our colonoscopies. Okay, so please let's remember these tests. If you haven't had your colonoscopy and you're 45 years or above, please just ask your GP, your health practitioner, to refer you for a colonoscopy. It may save your life. Another important factor when we're talking about cancer is cancer prevention. A lot of people ask me what they can do to reduce their risk of developing cancer. To answer this, we have to look into the risk factors, which are things that increase our chances of developing cancer. I would like to say to you, ladies and gentlemen, that cancer can happen to anyone. None of us is immune. It is not because of bad luck or munyama, like some people think, or being bewitched, kuroiwa. It just happens to all of us. I've had patients who've refused treatment before they've actually gone to a nganga to understand why they developed cancer. I had a young lady, she was 28, just started a good job, she had her master's, earning a lot of money, and then the next thing she's been diagnosed with cancer. She just couldn't accept it. She said, I've worked so hard my whole life. I'm not even married yet, I have no children, I've gotten a good job, I've been the best child in the family. So her main thing that she wanted to do was to go and ask the witch doctor, Nganga, the unfortunate thing with this is it causes a lot of division, a lot of hatred in the families for a disease that just happens to us. And I always like to tell people that as long as you are flesh and blood, cancer can happen. Animals also get cancer. That is something that just happens to us. So we are not immune. So once you remember that it doesn't matter who you are, it doesn't choose. We get it all the way from young children that are born with cancer. But they can. We've all heard of kids can. Taking care of young children that are born with cancer, teenagers with cancer, all the way to the elderly with cancer. This is a disease that anybody can get. So it can happen. The most important thing is for us to catch it early. However, when it comes to factors that increase our risk of developing cancer, we always look at some factors that we cannot do anything about, such as our age, Aging is a blessing. We get older, and we have to embrace getting older. But unfortunately, with getting older, there's also diseases that come with the aging process, and cancer is one of them. We can't do anything about it. We just have to be aware. The older we get, the more we've got to get checked. We shouldn't forget Vanasekuru, Vanambuya in the rural areas, because they're also aging. They're at risk of developing cancers. A lot of the times, people that are still working are the ones that go for their pap smears, for their mammograms, their PSAs, and they forget their relatives in the rural areas. So we always need to remember that. Our gender, just being female, puts us at risk of developing cervical cancer, breast cancer. Yes, it has been mentioned that men also get breast cancer. But certain cancers are more prone with certain genders. The same with prostate cancer, it's a man's cancer. We also have what we call family history, genetic risk. That is something we cannot do anything about. We cannot choose the family that we're born into. We can't choose our ancestors, our parents. So if there is a family history, then one may have a genetic risk of developing cancer. So it's important for us to know what cancers run through our family. Let's start talking. I know in African culture, sometimes it's taboo to ask, kuti chini chakauraya mbuya ningi? Chini chakauraya mai nini sekuru ningi? But it's important. Some people like to keep it a secret. I do have patients who tell me, I have not told anybody. It's just my nuclear family that know that I've got cancer. We actually need to stop that practice and let everybody in the family know that you've been diagnosed with cancer, because it may point towards a genetic risk. So just knowing is important, because you're empowered and you can go for your screening early. The most important risk factors, I find, are the modifiable factors that we can actually do something about. And here we're looking at mainly dietary and lifestyle factors. We are in control of these factors. These are things that we decide to do on a day-to-day basis, so we can actually stop doing these practices. Number one being cigarette smoking. We do not recommend cigarette smoking. It's been linked to most of the cancers that develop. Cigarettes have over 200 carcinogens, which are cancer-causing agents. So cigarette smoking puts the person who's smoking at risk. It also puts the person who is in the vicinity, what we call secondhand smoking, at risk. So whoever is near you is taking in, inhaling that smoke, is also put at risk. So let us desist from cigarette smoking. It causes a lot of cancers. Alcohol drinking, we do not recommend. Alcohol also is a toxin that increases the risk of breast cancer, prostate cancer, colon cancer, and a lot of other cancers. Lack of physical activity and exercise. This is the taking care of the body that was mentioned just now. It's important to take care of the body that needs to continue to work. And once we engage in regular physical activity, like what has just happened today, it needs to be done on a regular basis. That helps us to reduce the risk of cancers and other lifestyle diseases. Obesity is also a risk factor for cancers. I know in our culture, we say when one develops a big tummy, it's a success curve. When the women get bigger, they've been married, that they're being well taken care of. But I'd just like to change that narrative. Obesity is not good for us. It increases the risk of cancers. It increases the risk of other conditions such as diabetes, high blood pressure. So when we do exercise, eat well, we manage our weight and we avoid obesity. Poor diet has been linked to a lot of cancers. And a lot of people ask me, why is it that we have more cancers? This is not a disease that we used to know in Africa, especially when we're still in the rural areas. What has changed is our dietary patterns. We have adopted a Western diet that we've taken on for ourselves, and unfortunately it's harming us. It's coming with new diseases such as cancer. So we need to go back to our diet. When people ask me what should I eat, I always say to them, just imagine, what do you grow? What do you eat? That food is very healthy for us. So here we're looking at reducing intake of sugar. Sugar can increase our risk of developing cancers. Reducing intake of fatty foods, processed foods, these are part of the Western diet. So foods that are processed meats, your bacon, your sausage, all those. You wonder, as they're processing it, what chemical substances are they putting into that meat? Those colored foods, the colored crisps that we like to give to our children, that coloring, you ask yourself, what chemical has been put into that? And our children are eating this on a day-to-day basis. So we really need to start rethinking our diets, the meat that we take in. Red meat has been found to increase the risk of cancers. We do prefer white meat, that's fish and chicken, so we need to cut down on our intake of red meat. And another important factor is a lowered immune system. The immune system was prepared by our good Lord to protect our bodies, and it protects us from infections, but also it protects us from cancers. Each and every one of us, at any given time, we have cancerous cells that are forming. But what saves us is our immune cells, our white cells. They go around the body, they clean up the body of these cancer cells that are forming, so we don't get cancer. But when our immune system is lowered, then that defense mechanism is lowered. Our immune system is lowered by chronic stress. Stress, I know we're living in stressful environments. It can be stress from our jobs, from our home environment. It can just be stress just from the way that we're living. Sometimes we can't remove ourselves from the stressful environment, but we can actually find ways of relieving that stress. Different ways. Exercise was mentioned as one of the ways. Meditation, praying can help. Just going to have coffee with a friend, taking a walk, listening to music. We all have different ways that we can relieve stress. I really recommend, ladies and gentlemen, to try the ways of relieving stress. It helps to keep our immune system strong and protects us. In our environment, HIV is still quite a significant problem. So we also need to know our HIV status. We are aware HIV lowers the immune system if one is infected. So it's important to know your status so you quickly get treated and you strengthen your immune system. That is very important. It actually can save you from developing cancers. So knowledge of these risk factors is important so that we can take charge of our health, make healthy lifestyle choices. Let us be conscious of what we eat and drink. I always say we are what you eat and drink. Let us be physically active, avoid alcohol and cigarette smoking. Another thing that I would like to just mention is we are now in the year 2024. A lot of progress, technology has happened to get us here. And unfortunately, we don't take advantage of this. We are 24 years from the turn of the new millennium, but sadly, there's a huge knowledge gap in our society on current evidence-based cancer treatments, such as surgery, chemotherapy, kurapa cancer and mushonga. These are chemicals that treat cancer, and radiotherapy. This is use of high-energy X-rays. My X-rays, anorapa cancer. There's been a lot of developments in cancer treatment. These treatments have proven to prolong patients' lives and improve our chances of cure. But it is quite unfortunate that the herbal pandemic and unscrupulous religious leaders peddling misinformation in our communities have led patients astray. Many patients have gone to healing schools and have avoided treatment, only to come back when the cancer is advanced. This is very unfortunate. A lot of patients are taking herbs only to come back when the cancer is too advanced and is no longer curable. We really need to take advantage of the advancements in our treatments and not be led astray. Cancer patients in Zimbabwe are robbed of their hard-earned income by taking up unproven therapies with detrimental consequences. By the time patients present to us, it's already late. Advanced disease is the single leading cause of poor cancer outcomes. Surgery, chemotherapy, radiotherapy, these are safe treatments, highly effective. Our earnest and sincere prayer as oncologists is that these life-saving cancer treatments become accessible to the entire population without geographical or financial barriers. It is still an issue that cancer treatments are only available in the major cities, Harare and Bulawayo. A lot of patients have to travel long distances to access these treatments, and a lot of patients cannot afford these treatments. So we really pray that these become more affordable. I would like to end my speech on a positive note. We are living in an era where there's a lot of research and medical advancements which offer new hope for us. These treatments, such as immunotherapy, targeted therapy, precision medicine, are resulting in improved cancer treatment outcomes worldwide. These are expensive treatments, costing $10,000 to $50,000 a month. We would like Zimbabwe to also have access to these treatments and make them cheaper, subsidize them for the population. There have been improvements in screening and early detection of cancers. Screening, ladies and gentlemen, is looking for cancer, looking for disease before one has any symptoms. Do not wait to start feeling sick, to start feeling uncomfortable. When you are feeling well, that's when we want you to go for screening. To go there, have your pap smears, have your mammograms, have your PSA tests, have your colonoscopies. We really have had major improvements in how we screen for cancers and detect them early. Let's take advantage of these developments. We must keep the hope alive and ensure that no one fights cancer alone. Attitude is everything. Positivity, gratitude, and resilience can transform our journey. Let us focus on living and not just surviving. What can you do? You need to get informed, like what I've been trying to do, inform you. Get screened, please. From here, I hope we all get screened. Let's support our loved ones that are going through the journey. For those who can, let's fund cancer research. Let's fund organizations that are supporting cancer treatments. For those who are going through the journey or have been through the journey, please share your story. It helps to encourage somebody else who's walking that journey. Cancer may take our hair, our strength, or our loved ones, but it cannot take our hope. We are stronger together. We are resilient. We are survivors. As Nelson Mandela said, the greatest glory in living lies not in never falling, but in rising every time we fall. Let's rise above cancer. Let's face it with courage and determination. Let us work together to improve access to care for all Zimbabweans. Thank you, and God bless you and our beautiful country, Zimbabwe.